Hi there, Mom. I know you're probably wondering what tests are most important to make sure that your baby is at their healthiest. I know when you go to the doctor, it just seems like, there's so many tests that you need to do, and a lot of them can be confusing. Today, I am going to walk you through what those tests are, what they mean, and when they need to be done. Just think of this video as your prenatal testing roadmap. If you're new here, my name is Adetitu and I am a board-certified women's health nurse practitioner. I'm also a mom of 2, so I have been through these tests twice. Let's dive in. So for your first visit, when you first get that positive pregnancy test, it may seem as if there are a million tests that are being ordered. But here's what you actually need to know, Mom. So the first one is a complete blood count and a general OB panel, all right? And we're gonna talk about the most important ones. So one of them is to check for your blood type and RH factor. I'm gonna explain what RH factor is. So our blood is either RH positive or RH negative. Now, if you, Mom, are RH negative, your baby has a chance of either having RH negative blood, or if Dad has RH positive, can have RH positive blood. But if baby has RH positive blood, what can happen is your RH negative blood does not recognize positive RH. So it can start to attack this positive protein as foreign, and it can make antibodies against it, okay? And this can cause issues with future pregnancies, okay? So we test to see what your RH factor is to determine how to move further, all right? Now, to prevent this from happening in your future pregnancies, we simply just give you a shot called RhoGAM, and what this does is it stops your body from creating these antibodies against your future pregnancies. And next is anemia screening. This is part of the blood test. Now, you know that anemia is very important because iron carries oxygen, right? So if low iron happens, then less oxygen goes to baby, and this can affect baby's development and also can affect their growth as well. So it's very important for us to actually know this level early on so that we can provide diet supplements or actual supplements as well. Now, these blood tests can also check there's a pattern as to whether you, Mom, are a carrier for certain conditions like thalassemia, okay? Especially if you didn't know beforehand. And what we can do is order additional genetic test screenings to check for these conditions. Now, again, these blood tests also check for your overall health, right? We're checking for your electrolytes. We're checking for your white blood cells to see if you have any active infections. We're checking for just a whole comprehensive look at how healthy you are, Mom. So next are genetic carrier screenings. These are routinely offered, not mandatory. However, Mom, you can be a carrier for certain genetic conditions that you may not have, but you are a carrier of, meaning that you can pass it on to your baby. So we're gonna go through some of these screenings. The first one is the cystic fibrosis screening. This can affect lungs and digestive system, and it is offered to all pregnant mothers, regardless of your ethnicity and family history. Next is spinal muscular atrophy. This can affect baby's muscle and movement. Again, these are offered to all pregnant mothers, regardless of your ethnicity and family history. So next are hemoglobinopathy screenings, and this is very important. This check whether you are a carrier for conditions such as thalassemia or sickle cell. The American College of Obstetricians and Gynecologists are now recommending that all pregnant women, regardless of their ethnicity, are being tested to see if they're carriers of these conditions. So once it's determined that you might be a carrier, further testing is done, such as hemoglobin electrophoresis. Now, this is especially important for women of African descent, Middle Eastern, Mediterranean, South Asian, as these women are known to have higher rates of these conditions. Okay, Mom, so next are infectious disease screenings. First are HIV screenings. This is recommended for all pregnant moms. Next is hepatitis B and C. This can be passed on to baby during birth, so we need to know. And then syphilis screening, again, can be passed on during birth. If you are positive for conditions such as syphilis, you would need to be treated before delivery. And then we're gonna check 2 tests to see if you're immune to these tests. That is a rubella immunity and varicella immunity. So that's chickenpox. We wanna make sure that you're immune to these. However, if you are not, you cannot get the vaccine. So the best precaution would be for you to stay away from anyone who's infected with these conditions. So next we're gonna do a urine test. And one of the tests we're gonna test for are urine culture. This is gonna check to see if you have any bladder infections, okay? Even if you don't have any symptoms. A lot of these can actually cause serious complications such as kidney infections or preterm labor. So we want to make sure that we catch these early on and treat them as soon as possible. So next, we're going to use your urine to test for protein screening. Okay, so protein in the urine is a way to identify whether you have a condition called preeclampsia. Preeclampsia is a serious condition that causes high blood pressure during pregnancy that can affect either you or baby. So it's very important for us to know your level early on so that we can monitor it and compare it to your later results. Okay, by checking your protein levels early on, we're able to know you're normal. All right. And then we're able to quickly spot any changes later on as preeclampsia develops usually later in pregnancy. Now, next are STI screenings. So we're checking for conditions such as gonorrhea or chlamydia. Now, these are very important to rule out because it can cause conditions such as preterm labor, low birth weight, premature rupture of membranes, meaning that your water broke too early. And if left untreated, it can actually cause permanent blindness in baby or serious eye infections. So let's make sure we rule that out. And then HCG monitoring, which is just monitoring your pregnancy hormone level. It can be done during your early pregnancy, especially if there are concerns about miscarriage or ectopic pregnancy. So we just want to see how much your HCG is increasing, okay? But it's not routinely monitored after a pregnancy is confirmed and growing as expected. So next are tests that you can do after week 10, all right? So now these are genetic testings and they are called the NIPT test. So the non-invasive prenatal testing. Mom, this is one of my favorite testing because it tells us so much and it's non-invasive. And it's just a simple blood test that can screen for conditions such as Down syndrome for baby, trisomy 13, trisomy 18, and other sex chromosome problems. And it can be done as early as 10 weeks. And also, Mom, it can detect baby's gender if you want to know. And it is between 98 to 99% accurate. These are screening. They are not diagnostic. If any of the results are abnormal, there will need to be a diagnostic test that needs to be done, such as amniocentesis or chorionic villus sampling. It's totally up to you. These tests are optional. Okay, Mom, let's talk about your second trimester testing, and we are going to start off with your genetic screening. So you have several options. First, you have the quad test, which is a blood test that is drawn and it measures 4 different substances. Now, these substances are able to help us determine and screen for things such as Down syndrome, trisomy 18, and neurotube defects. And the second one is the maternal serum alpha fetoprotein, the MSAFP. This is done between weeks 16 to 22, and it's a blood test that also detects these conditions. You can also do an ultrasound screening. This is usually preferred and is usually done during your anatomy scan. And now we're going to talk about the anatomy ultrasound, which is done between weeks 18 and 22. Mom, this is a fun one. You get to see how baby is growing. You get to learn about baby's organs to see how organs are growing. And as we've already discussed, this can help us detect any birth defects. And also you can find out baby's gender if you haven't already done so with the blood test. So exciting. Okay, next is glucose test to test for gestational diabetes. This is done between weeks 24 to 28. And I know this is not the fun one. A lot of moms have a lot of opinions about this, saying that it tastes like the nastiest, saltiest orange juice in the world. And I couldn't agree more. So the test is a 1-hour screening test. You're gonna drink this orange drink, and then 1 hour later, we're going to draw your blood and check for your glucose level. You do not need to fast for this initial screening. There are some discrepancies about that. For this 1 hour initial screening, you do not need to fast. However, if this result is abnormal, you're going to need to do the 3-hour fasting test. So for the 1 hour test, value of 140 or higher will mean that we need to do the 3-hour diagnostic test. So next, the third trimester testing. So we're gonna do another anemia check to make sure that during this trimester, your hemoglobin is more than 11. We're also going to make sure that we check for your iron levels. And next, during the 28th week is the RH factor follow-up. Okay, so mom, if you're RH negative, you're going to get this shot called RhoGAM. And what it's going to do is prevent you from making antibodies against your future pregnancies of your babies that are RH positive. So you're going to get this shot now, and you're also going to get this shot again after you've delivered and it's confirmed that your baby is RH positive. And then also anytime during the pregnancy, if you ever bleed, you're also going to get RhoGAM again as well. So next, if you're high risk, we're going to repeat testing for HIV, syphilis, gonorrhea, or chlamydia. And next is Group B Strep. This is done after week 36. This is a rectal swab to check to see if you have something called Group B Strep. It's just a bacteria that can affect baby. And not to worry, what's going to happen is if you are positive for this, you are just going to get antibiotics during labor. So those are all the tests that are routine and very important for you to get. Remember, if you get any results that are abnormal, do not panic. The point of us doing these tests is to monitor you and baby and also to implement any treatments that we can do early on. All these tests are designed to keep you and baby safe. So quick recap. First trimester, your OB health panel. All right, so this is checking for your overall health. And then we're doing genetic screenings as well, checking for your blood type, and also doing infectious disease screenings. All right, so just a full workup. And then 10 weeks plus, you can do the NIPT if you want. This is a genetic testing. All right. And then after 15 weeks, between 15 and 22 weeks, you can do the quad test, which is another genetic screening. And then the MSAFP, this test for neurotube defects. 18 to 22 weeks, you get your fun full anatomy test to look at baby. 24 to 28 weeks, you can do your glucose screening to check for gestational diabetes. 28 weeks, we check for anemia again, and then you get RhoGAM if you are RH negative mom. And then last but not least, after week 38, so between weeks 36 to 38, we are going to test to see if you have bacteria called Group B Strep. So those are all the tests that are very important during your pregnancy, mom. All right, mom, I hope this breakdown was very helpful for you. Remember, these tests are just tools to make sure that you have the healthiest possible pregnancy for you and your baby. If you have any specific questions about these tests, be sure to ask your healthcare provider simply because they know your specific situation best. As always, I do hope that you are taking very good care of yourself. Make sure you give this a thumbs up and share this with a mom who can really use this information. As always, take care of yourself, mama. I'll see you next time. Bye.